Welcome. I'm Kathy Cooey, Fund Development and Communications Officer with the High River District Healthcare Foundation. Before we kind of kick off our night, a few housekeeping things to go through. If you aren't familiar with Zoom and if you happen to lose connection or there's some connection issues, please just be patient. It typically corrects itself and will come back on. If there are other issues, down in the bottom, there's a little chat box. You can type in a message and we'll do our best to try and help. We've got Jody Seeley in the background helping us with technology. She will bring in our speakers. She will help us with our graphics. She will transition all of that, which means we have to switch programs. So we ask for some patience with that. Here is hoping technology, the internet, and my dog cooperate. We had hoped to share some videos tonight, but unfortunately the quality just wasn't there. So what we're going to do is send you an email tomorrow, and that email will include a link for tonight. Sorry, everyone keeps changing my screen. Sorry, I send you a link for tonight. It's hard when I'm used to looking at people and the screen keeps moving. Anyways, we'll send you a video link of tonight if there's something you want to listen to again, and a couple other videos we had hoped to share. Also in the bottom, there's a little reaction button. If at some point you want to give somebody a thumbs up, please feel free to have some fun with that. I do hope that you all got to Evelyn's and either have, because you couldn't wait, or are enjoying your treats that they baked up for us. So thank you for taking time to join us. It was 1 year ago tomorrow that we gathered at the golf course for this event, sampling delicious hors d'oeuvres and desserts, taking in the sounds of the upfront trio, and enjoying one another's company. Well, there were less handshakes and more elbow bumps and lots of bottles of hand sanitizer. I don't think that anyone could have guessed what was to come. Well, we have had to all had to maneuver through the unprecedented times that was no different for the foundation. Working much of the year from a different office or at our kitchen table, our spare room, or having to shift many of our fundraising initiatives. We turned what would have been our 34th annual dinner and auction into a drive-in concert. No more paper and pen silent auction, and to buy a raffle ticket, you had to log on to your phone or computer. What didn't change was the exceptional care that our healthcare team provided, highlighted even more so through these challenging times. We have a number of them joining us tonight. So on behalf of all of us here, I want to send our heartfelt thanks to all of you. The other thing that didn't change was that you, our donors, continued to share your generous support. You supported the COVID-19 community response campaign. You got in your vehicles for a country music drive-in concert. You logged on and you bid on an online auction and purchased raffle tickets, and continued to support the Roundup, Annual Appeal, and Points of Light campaigns. Also, our local team would have the enhanced tools and programs and services to care for our community. So thank you for your unwavering support. With there being no dinner and auction, we were also unable to present the Clifford and Louise Lawhead Award for Outstanding Philanthropy as we normally would. But as you may have seen in the local paper or on our social media, we were able to present it in a much more intimate setting to Bev and Blair Gordon. We wanted to take this opportunity again to recognize them in a more public setting. The foundation is very fortunate to have some incredibly passionate donors and supporters, but I'm not sure that there are any more than Bev and Blair. They not only care about helping to provide the best possible healthcare locally, but they also care deeply about those providing the care. Bev was one of the first to answer the call to support our local COVID-19 campaign with her sanitized check in a Ziploc bag, socially distancing, passing it off to me. Well, Blair and Bev's financial footprint has been significant for the foundation, coming on board as sponsor of many events that we host, supporting our local healthcare team through Healthcare Heroes. Their support goes far beyond this, and not just for our organization, but they bring their powerful promotional tools to the nonprofits they engage with by helping to promote the work they do through their social media outlets, bench programs, and advertising platforms. Given the chance, Blair and Bev would say this is not about them. It's about their amazing team at Century 21 Foothills and the hard work that they do that allows them to support so many community initiatives. In addition, they would give kudos to their tight-knit and incredibly funny family. They care about local healthcare, they care about our community, and they demonstrate that on a regular basis. Again, on behalf of all of us at the foundation and the local healthcare team, congratulations to Blair and Bev, and thank you for making a difference. I have to admit it, but even our High River Times has reported some fake news. If you read the paper the past few weeks, you may have seen a photo caption that indicated our executive director, Michael Brown, had retired. Well, he hasn't quite got away yet. He has to put up with Rhonda and I for just a little longer. So for one of his last few official public duties, please welcome Michael to provide the Foundation's 2020 financial snapshot.
Okay, thank you, Kathy. That's very, very kind of you. I'm a little taken aback. I wasn't expecting that photo. I feel like a Monty Python character with the famous line of, "I'm not dead yet." But welcome, everyone. It's so wonderful that everyone is joining us online. I can see down at the bottom of my screen, we now have 50 participants, so that's absolutely fabulous. So my job is I'm going to give you a little snapshot about the finances at the foundation in the 2020 calendar year. So talking money for a few minutes here. If you're so inclined, this would be a good time for a bathroom break, but we'll dive right into it. So the bottom line is the story in 2020 was more or less very similar to what happened in 2019. It wasn't, we went through the economic turmoil like the rest of the world did, and there we struggled a bit, but we also did incredibly well in so many other ways. So one of the biggest things I want to point out just off the top is that we've had a change in our accounting practices, and we moved our fiscal year to March 31st. So the numbers that I'm showing you are going to be the calendar year of 2020. So these are unaudited numbers. They're pretty darn close, but our auditor hasn't gone through them in any detail. So what you're seeing in front of you was, overall, our revenue was definitely down compared to the prior 3 years on average, but compared to 2019, we actually did very well. And again, considering the circumstances. Fundraising donation or fundraising revenue, net revenue, again, as Kathy alluded to, we shifted from having a dinner and auction to a drive-in, and those are the things that took a hit. On the other hand, our operating revenue is up substantially. That represents how well our investments did in our endowment fund and monies that we're just holding in investments. And if you recall, the end of 2019, early 2020 was a pretty sad time for all investments, and we dipped along with that, but through the course of the year have recovered. So, again, total overall, our revenue, we did okay, but largely because of our endowment fund investment. So Jody, could you shift to the next slide, please? So when I talk about endowment fund, these are the investments that the foundation or the assets the foundation holds. So our endowment fund did very well throughout the course of 2020. And if there's a message that I want people to take away tonight, what assets represent to a nonprofit is those are stability in our finances and sustainability. Because we have that endowment fund being able to earn us revenue, we don't get hit and go with the little ups and downs of our fundraising good fortune or misfortune. The biggest thing is that what those assets really represent is long-term stability for future generations. So we are really, really lucky and appreciative of all the support we've gotten over the years that has enabled us to be in that position. Okay, the next slide, Jody. So this is just the numbers behind the magnitude of what we do. So in 2020, we invested $240,000. We made commitments of another $85,000 that we hadn't been billed for by the end of 2020. So that represents $325,000. And we can't do that without your support. So we're incredibly grateful. The other piece that, again, just because of year ends and the way it was recorded, is we have now paid off our final installment on the maternity project, which was another $216,000, and that's not included in this number. But again, it just gives you an idea of the magnitude of what we do. So we're incredibly grateful. These investments in equipment and programs, I'm not going to go into the details because what we're going to do next is I'm going to invite Jennifer Martin, who's the long-term care and the site manager at the High River Hospital, and she'll tell you a little bit about the impact of some of our investments through 2020. So here's Jen. We need to unmute Jen.
Oh,
There
okay.
we go.
Hi, everybody. Thank you so much for allowing me to have the honor of speaking with you all today. As an Alberta Health Services representative, I'm sharing a message of gratitude from the administration and staff from High River, Nanton, and our surrounding areas. I'm going to begin with a thank you, and I'm going to end with a story. I want to start by acknowledging the unbelievable support the healthcare team has felt from donors like you. A year ago, we found ourselves in uncharted and frightening territory. As the world was asked to pause, we were ramping up. The foundation saw the pressure point and realized that to care for our community, the healthcare team needed some care too. And it seemed like it took a hot minute where Michael, Kathy, and Rhonda rallied the community troops, and we were showered with unbelievable generosity. This community came together and provided masks, headgear, cloth scrub bags, team shirts, cards, parades, individually prepared food items, and chocolate. So much wonderful chocolate, plus so much more. This COVID care initiative often gave us the push and the encouragement to carry on, and we are so grateful. And now to story. I like to refer to it as the tub effect. Many of you know we were tasked to create space to take some capacity pressures off the city as the second wave of COVID ramped up. In the course of 2 weeks, we created a working nursing unit with 23 beds to support this ask. I need to back up a bit. Regardless of this ask and the timeline we were given, we still had to meet basic healthcare standards. And in this case, we needed a tub to provide basic care, which I'm sure you can all appreciate. So no tub, no unit. And it's not like you can just run down to Home Depot and pick one of these bad boys up. Nope, they're unique, clinical, and costly. So we needed it done, and we needed it done quickly, and we needed it done right. So we asked the foundation. That's all I had to do. Michael told me to let him know of the tub we wanted, and he would look after the rest. And the foundation did just that. We had a lovely therapeutic tub with all the bells and whistles ready to go. Then we started working with the city to offload some of their acute care beds. And the patients started arriving here at the end of December. And this is when we got to meet Gus. Now, Gus is a 37-year-old guy with quite a story. Some tough circumstances, maybe some questionable choices, and the diagnosis of a progressive disease landed Gus in an urban hospital. It was determined through the healthcare team that Gus's needs required long-term care support. To that end, the transitions wheel started turning. His only option was total care placement. Nothing else was offered. Well, you can imagine Gus, who is clever, social, and looking for meaningful connection, was none too pleased about this. Would you be if you were a young man and the median age of your potential fellow roommates was going to be 80? So his placement was complex, and through different situations and circumstance, Gus was in the acute care hospital setting for the greater part of a year. Then he was transferred to us on 2 West. And to be honest, not a happy camper about it. By the time Gus arrived on our unit, he was, shall I say, a bit colorful. And did you know that some swears can be used as a noun, a verb, and an adjective, all in the same sentence? Yeah, well, now I do. So our rural team entered into Gus's life, and we did what we do best. We listened and we connected. Then we got creative. We looked for solutions instead of problems, and we tried to make Gus the captain of his ship. We quickly learned that Gus felt out of control of his life. He felt his choices were removed, and he really had a lot of living to do. We asked him what he wanted. He wanted to live on his own, in his own space for as long as he possibly could. So in the interest of brevity, I will jump ahead to today. Gus has been with us for 2.5 months. He has made connections and friendships with staff and other patients and is feeling far more in control of his life. I really do think he likes us here. And in that time, our complex transitions team, working with social work, nursing, supportive therapies, and others, have advocated and planned for him. And now, Well, Gus has been removed from any long-term care placement list, and he will be moving into his own wheelchair-accessible apartment with home care supports within the next 2 weeks. This is a very big win for Gus. So, moral of this story, without your generosity and commitment to this community, we would not have been able to open 2 West. We wouldn't have been able to meet the wonderful Gus, and potentially he would still be fighting a system that wasn't giving him what he needed. You are also supporting the staff, which provided tools to build resiliency, grit, and hope. This translates into creativity, innovation, and outside-the-box thinking, which serves our patients and residents in High River, Nanton, and the surrounding areas. So your support does make all the difference in the world. And before I introduce you to our next guest speaker, I wanted you all to have an opportunity to look into the face of someone who has been directly and positively impacted by your generosity. Respected donors, guests, and foundation board, I am very honored to introduce you to my friend Gus.
Hi,
This is Gus.
thank you very much for your generosity. This is the only place I've come where they haven't tried sticking me in long-term care, and they're actually giving me a chance what I want. Like she said, I'm 37. I don't want to live with 80-year-olds. And Jen's given me that chance, and her staff here is wonderful. Even through my behavioral issues, I've had ups and downs, but they've supported me all the way. And I love them here.
Oh, thanks, Gus. We think you're okay too.
Yeah, you
All
love me.
right. Well, and now after meeting the wonderful Gus, and now you can understand why we are feeling so impactful to him and he to us, it's my pleasure to turn the screen over to a great champion of this community. He's a local physician with a family practice. He also provides care in our High River Hospital Emergency Inpatient Unit, Long-Term Care, Community Cancer Clinic, and he is the board chair of the Calgary Rural Primary Care Network. Ladies and gentlemen, I introduce the amazing Dr. Adam Weiss.
Well, hi, Jen. Thanks for that wonderful introduction. I'm just a little technical thing. Maybe Jen, you're on my screen. How's the audio sound? Thumbs up. And hi, Gus. Great to meet you. Maybe we'll see you in person someday, buddy. That was fabulous. Thank you. So good evening, everybody. I'm just going to share my screen here. We're going to see if this technology works. I've spoken at a few of these events before, and usually I try to give you some insights into the unique and amazing world of the High River Hospital. And as you know, it's been 11 months since COVID came to High River. I heard it was the exactly 1-year anniversary, I think today or yesterday, of the sort of announcement that there was a pandemic in Canada. But 11 months ago, COVID came to High River and to the Cargill meatpacking plant and changed our lives forever. And many of us during that time became experts in successfully managing a huge COVID-19 outbreak in a small town. So tonight I thought I'd share some of my views of the events, the stories, and some learnings from the past year that have given me hope and pride. And some of these things we've shared around the province, around the country, even across North America. And because as usual in High River, we tend to do things right. So I put together a mashup of several of the presentations that I and some colleagues have done. And as usual, I have a couple of metaphors for you to chew on against the advice of my better half. So we'll see how I do with metaphors tonight. But first, it feels strange to talk about successes when we had casualties, and we were not perfect. Boy Hep worked at Cargill for 18 years. Benito Quesada left a young family in High River, and Armando Saleg was visiting his son. 5 out of 15 second-floor residents died from infection that snuck in. These were all casualties of COVID-19, and that particular COVID-19 outbreak, and my condolences go to their families. Some of them I actually don't know, but some may actually be with us tonight. So if you are, my condolences are with you. But I feel that the successes come from the fact that I feared it would be far worse, like Italy or New York City. And And when we really got it right, we were able to integrate all levels of the healthcare system to make a complete response. And it turns out that that has rarely happened really anywhere. So this is the Globe and Mail. One of the articles they wrote about this, you can see there, just give you a little taste of the magnitude of this outbreak. There was 936 employees tested positive. Many more probably had the disease that were never tested. About a third of those people lived in High River. We think there was over 1,500 cases. My estimate is that about for every one employee, there was one other contact that ended up positive for COVID-19. So this, as you may know, is a, I'm not sure, there we go. This is the epidemiology curve, which now every lay person has seen. It used to be just in the realm of the science geeks like me. This was at the end of August, but during here you can see we've overlaid the Cargill outbreak. So this is the Canadian epidemiology data. You can see that 15 to 20% of the cases came from that Cargill outbreak in the whole of the country during that time. I've overlaid a couple of people. So this on the left is Soon, and I'll tell you a little story about Soon. She's a patient of mine. And on the right is Asha. She's a patient of a colleague of mine from Northeast Calgary. And the point of this is that each one of these bars that total up the number of cases are actually, when you think about it, they are comprised of individual people. And it turns out that logically speaking, logically as you think, the actions of each individual that gets infected will determine the shape of the curve that follows from them. And whatever they do has an impact on what happens to this curve. So here's a little bit of the demographics of who works at Cargill, who got impacted. Mostly temporary foreign workers, refugees, immigrants. So anybody that pays attention to some social science knows about socioeconomic status, but we've coined the phrase socio-ethno-economic status because the ethnicity really has an impact in the health of these people and how it turns out you have to help them to optimize their health because they have English as a second language, because they don't understand the healthcare system here and they have low health literacy. And a lot of precarious job security, imagined or real. So here's the first of my metaphors. As you can see, this is a big tree. I called my talk, Seeing the Forest and the Trees. And so this is a big tree. You can tell looking at it that those are my kids a few years ago. My son's now 6'4". But the tree is really large. Like that's about 8 feet across, and you can tell it's a Douglas fir, but you can't tell much more about it. And you probably wouldn't, unless you knew that tree, you wouldn't know exactly where it is. And maybe you'd need to see a view of the forest. So if I showed you that view of the forest, you might have a better idea of where it is. And that's the view I get driving to work every day. And in June, Holy Cross Mountain lights up like that. So that's about 30 miles west of High River. And that tree lives in that forest in High River. And you'd never, or in the foothills of the mountains. And you'd never guess that unless you got right up close and saw it. But nor would you understand why it was there unless you looked at the mountain and saw that all that snow, I'm going to have a pointer right here, coming down that cross, all that meltwater runs right into where that tree is, in behind that middle ridge there. And this is the sort of the view from a local forest view. And you can see that tree is 8 feet across at the base, but it's only 50 or 60 feet tall. There's many trees outside the hospital that are taller than that tree. So you know that it's living in a stunted environment, and unbelievable, it's probably 800 years old. So my point is having a view of the tree and the forest kind of puts it all together, gives you a better picture of what's going on. And it turns out it's no different when it comes to healthcare and in particular, COVID-19. Here's my second analogy for you, or metaphor. It's been said that we all are in the same storm with COVID-19. That may be true, but we're all in different boats. And I love this picture because I think that I probably live on that aircraft carrier actually. And we sail through the waves pretty well. But imagine the plight of people in those little dinghies and life rafts on the bottom of the picture. It's a totally different experience being in that storm for them. So getting back to our outbreak, what happened? We realized that we had a big problem around Easter of last year, and we sounded the alarm. Our primary care network was at the center of this response, and what we realized was there was a lot of fear and panic in the community, and what they needed was somebody local to talk to. And we set up this testing center with a call line. We took 900 calls over the course of a weekend, did 250 swabs for people. That was before the mass swab sites were available through Alberta Health Services. But to make that happen, we had partners, obviously, through public health and right up to the top levels of public health in Alberta, actually, through Alberta Health Services at High River Hospital, and Jen was a big part of this. Informatics, we had to make sure that all the information got back to us once we sent swabs away. That's half the battle, but the other half is figuring out who was sick and how to identify them. The town of High River was huge. Mayor Craig, as usual, rose to the occasion. The Calgary Catholic Immigration Society connects with all of a lot of the workers, especially in High River. So they were very helpful with some of the social needs. And then our other primary care networks in Mosaic and northeast of Calgary and South Calgary primary care network. So it turns out that the workers at Cargill were about a third in High River, a third in northeast Calgary, and a third in South Calgary. So we all had to partner together. The notion we had is that COVID-19 causes a mild disease in most people, which is really a community disease. And so who best to deal with that other than their primary care physicians, their family doctors, and their primary care networks. That plan we had put into place in March and signed. The ink was barely dry on our action plan before COVID came to town. I got to mention our seniors lodges, supported living and long-term care facilities. So other than the outbreak that happened in our second floor, before we even knew there was a problem, actually, we had a fan out, and basically managers were advised to tell their workers to stay home if anybody in their family was sick. And the net result of everything, no cases in any of the other sites other than second floor. And all are now vaccinated, which is fabulous news. So it's not zero risk now, but it's a whole lot different than it was for those people. So to me, that right there is why we did what we did. But I want to tell you two other stories. So I showed you those two pictures of people. So this is Sang. She's one of my patients. I've known her for almost 25 years. And she's from Laos. And her mom is Soon, who's 86, has diabetes. And her son Danny has autism and asthma, so he's got some risk factors. So these people were really at grave danger if they caught COVID-19. Well, Joe works at Cargill and got sick and tested positive. And so when we got involved with the case, Joe had been sick for a few days. Sang was just coming down with illness herself. And so the only thing we could do was the in-home isolation. So support from us, from our primary care network, helping her, just crystallizing what she had to do to get her daughter to bring supplies in, to make sure they didn't leave the house and spread infection, to make sure that they did all those sanitizing things. and understanding that Joe could help when he got better, which he did. And basically, we were just cheerleaders. And the net result is that neither Danny nor Soon got sick, and both are well today. So here's my second story. I've stolen this from Dr. Annalie Coakley, who's one of my colleagues that I've done a lot of these presentations with. So she tells the story probably better than I do, but I've stolen it because it's such a great story. I thought you should hear it. This is Asha. So she's from Somalia. Her children are in Kenya. She's a single mother to 4 kids. So she works at Cargill and sends her wages back to Kenya to support her children in their education. When this outbreak started, she was evicted. She wasn't sick, but her landlord heard that she worked at Cargill, there was an outbreak, and he evicted her. So she found another room to rent with 5 other people, was about to move, and had to do swabs to go back to work, and lo and behold, hers was positive. So she was obviously, you can imagine this, being a refugee, new to Canada, have a temporary foreign worker job. She panicked. And she was connected with our Mosaic Primary Care Network through basically one of the systems we set up to find these people when we got test results and we realized that they were sick and they didn't have family physicians. We had a system to at least give them a phone call. And these folks managed to find her an isolation hotel. You might have heard of those. There was lots of troubles around, but this worked in her case. So when she got sick, she got medicine delivered. When she had fears, they had counselors that could help her and talk to her. And she needed culturally sensitive food because this was Ramadan, and they managed to be able to help her with that. So she got better, and after 10 days was able to go back home and move into her new digs with the help of CCIS again. None of her household contacts were infected, so the chain was broken with her. And I just think this is a stunning example of how blending and organizing all of our resources together are provide this, oh goodness. There we go. So blending all these organizations together provide this holistic care, and especially I think it's true for every part of the healthcare system, but COVID-19 really has brought it all together and crystallized it, because COVID-19 happens so fast and the disease comes so quickly, and the actions you have impacts you. You see what happens right away within 2 weeks. So I'll put it all together for you. Here's my metaphor collected back together for you. So individual people are the trees, and we had people on our team seeing the forest, the big picture, some from the middle distance and some right up front, and they saw the tree right up close, saw that dealt with the individual people. And the team was able to be rapid and thorough, and because of that, our community remained healthy. So our See the Forest and the Trees team approach has now been scaled up. We used it over the summer with Hutterite colonies, which you probably didn't hear much about because it ended up being not a huge deal, and our First Nation Reserve outbreaks, which was a little more difficult. And now this approach has been adopted province-wide. So very cool. So we've spread the word because we thought we were onto something, and so we wrote a few things, and then people asked us to write more things. And so on the corner of my desk, because I've got nothing better to do, we've done a bit of writing and presented at a few conferences, and even at this big journal in the United States, the Health Affairs Journal was interested in our story. So if anybody's interested in any of these, you're welcome to get a hold of Kathy, and I'm sure she can post or send links or get me to do it. If anybody knows the Barron family, I'd love to tell them that I've stolen their poster. This is was up in the hospital for the longest time. I thought it was the most amazing poster. And but I have some thank yous. First of all, my collaborators, Annalie Coakley and Shagata Chakraborty from Calgary, who have been amazing to work with. The medical staff of the High River Hospital. So this is not my story. I'm just up here being the talking head. So the medical staff are fabulous. I think most donors here know that, but I just have to say it. It's the best group. Everybody works together and looks out for each other and has such a high bar for medical care. The staff at the hospital, Jen and her staff in long-term care, and Chantal and all this, the active care stuff, phenomenal. The lab was amazing. And then Louise and her contacts through the zone. This was a major team effort through Alberta Health Services. And really right to the top, right to provincial level. Public health was unbelievable. So Dr. Jahu, you might see his name in the news a lot. He was a major champion, and he remains so. We're partnering on vaccine efforts, a number of those together still. Community agencies like Calgary Catholic Immigration Services were amazing. The town of High River was fabulous. They gave us the culture center, and Craig basically said, have what you need, and we had town employees helping us get things set up. Our primary care network is unbelievable. People don't know much about a primary care network. It's a group of family docs, and Stephanie Crichton's our executive director, Terry Shaw and Don Shaver are directors, clinical directors, and as well as all the other docs that are connected with us in other towns are amazing. The Calgary Zone docs who bought into this plan, and basically because of that, we were able to kick it into high gear. And finally, the foundation and you, the donors, you're a key piece of this wonderful medical community. You guys are who we do this for, and you're part of that community, but also you guys make it that special place. You know, all the actions of the foundation just raise the level of things we can do. And if you look back over the years, it's unbelievable. We wouldn't be where we are without the foundation. So thank you once again for your support. You're amazing. And thanks for listening.
You guys ready for me? Can you hear me?
We can.
Okay, my name is Kelly Mellenberg, excuse me, and I'm the foundation board chairman. I'd like to take this time to thank Dr. Weiss and his staff for guiding us through probably some of the hardest times we've obviously experienced in recent memory. I'd also like to take this time to thank all of our donors, for without you guys, our accomplishments over the year would not be possible. Thanks to you and your donations, we've been successful in adding a cancer treatment facility and just recently completed a state-of-the-art maternity ward to our hospital. We've established a fantastic relationship with our local healthcare team, and this relationship is very important and a positive attribute to our community. Also, a great appreciation to our foundation success would not be possible without our outstanding staff of Michael Brown, Kathy Cooey, and Rhonda Buse. As well, I want to thank my fellow board members that sit on the foundation. They put a lot of countless hours in trying to provide, making sure that those endowment funds are being well used. I look forward to our new goals and hopefully a prosperous 2021 in this wonderful community. Hopefully we can salvage 2021 and get back to normal. And on a final note, I just want to send my best wishes to Michael upon his retirement. His legacy will remain for years to come. A lot of good things were done with Michael here, and he's going to be sorely missed. So with that, again, thank you donors for continuing to support this foundation. Probably one of the best in Southern Alberta. And yeah, that's all I have to say. I'll pass it on to Michael.
There I am. And I'm being heard. So thank you, Kelly. As Kelly pointed out, he is the chairman of our board chair. And I want to give a special shout out to our current board. They are volunteers. They volunteer in this community. They give their time and their talent, and they do a fabulous job. And I am just so grateful to them and to all the people who have volunteered on our board over the 12 years that I've been on the foundation. So a big shout out to Kelly. You've already met Jen Morton, our AHS representative on the board. Absolutely fabulous. Dr. Chris Warner is chief of staff here at the hospital, and he is now our physician rep, and he is a new dad. So congratulations to Chris and Maria and little Aria. Aria, don't worry, your dad will grow up someday. Aaron Mauser is our vice chair. Chris Alexander is our treasurer. Juanita DeBolt is our secretary. Ruthella Graham represents the auxiliary here on the foundation board, and the auxiliary does so much for us. They're a fabulous group, so thank you, thank you. Vidya Kaushik. Vidya, I gotta say thank you so much, because she acts as recording secretary during the meetings, and that's a lot of work, and really appreciate it. Glenda Cutforth's on our board, Verna Lemann's on our board, and our newest and our Nantonist representative is Roxy Weidman. And so thank you all so much. You do a fabulous job, and I know a lot of former board members are out there listening tonight. Thank you, thank you, thank you. You've done so much to help steer this organization. It's just been absolutely amazing. And along that line, I will make a little plug that we are going to be having a vacancy open up come September. So we are on the lookout for a new board member to join us, someone with some financial acumen. So if you're at all interested, or you know someone who might be interested, please send them our way, or put your hand up and we'll talk. So my job is so often the case is just to say thank you. I mean, my gag is our mothers taught us to say thank yous. Thank yous are so important. So big special shout out to Dr. Adam Weiss. Thank you, Adam. You did a great job. Jen, Kelly, well done. Thank you so much. I gotta say a thank you to Hubert and the gang down at Evelyn's, because those were wonderful treats that we were able to, maybe red wine would have been good, but Evelyn's treats are awfully good. Jody Seeley's in the background making all this happen. Thank you so much, Jody, as always. The other two that I really got to say a big thank you just about tonight, but just in general. Rhonda Buse, who I've worked with now. Rhonda, I think it's been 5 years, and there's Rhonda.
Hi, everyone.
Or Rhonda, Cheryl Holmes, but Rhonda and Kathy Cooey are just an amazing dynamic duo that makes this place tick. And Kathy and I have now worked together for 12 years, and it's been fantastic. And I cannot say enough or thank you enough to Kathy. So thank you, thank you. All the medical people who are on board with us tonight, the docs, the nurses, the managers, the administrator, but the support staff too. One of the things I learned when I came here without a medical background whatsoever is how complex our medical system is, how important the cleaners are to keeping this hospital safe and operating, how important the engineers are, how important the physios are, and the rec therapists, just everyone. It is utterly astounding to me as a non-medical person how much teamwork, and how every little spoke in the wheel is absolutely essential. So thank you to all of them. And also, of course, from a foundation point of view, thank you to our donors, all of you that are out there listening tonight, our donors, our supporters. You know, High River is an amazing little place. Nanton is just punches way above its weight. Can't thank you enough for all the support we receive from Nanton, from High River, from the rural areas. It makes this place just exceptional. I think Adam alluded to it. It really is an exceptional facility, and that adds a huge dimension into our community. So thank you to you all. I am very hopeful that next year we can be back in the golf course or golf club, maybe without masks. We'll see. Maybe with a glass of red wine in our hands. We'll see. But thank you all. Thank you for joining us tonight. I am assuming that there is no, I can see Kathy nodding at me. There is no videos, unfortunately, tonight. So thank you all. I think it's time to say goodnight and goodbye. Thank you for joining us. Good night now.
Good night, everybody.
Good
Thanks
night.
for joining
Good
us.
night. Thank you.
Thank you.